This question says, which of the following is a common error when measuring blood pressure manually? So the question is asking for something that could be done incorrectly when you're measuring blood pressure. Option A says using a stethoscope that is too large. And that is correct, because if you use a stethoscope that is too large, such as using a large adult-sized stethoscope on an infant, it might make it more difficult to hear the sounds that you're listening for, and then could lead to an incorrect result. So we could go with option A for now, but let's look at the other choices. Option B says placing the cuff over clothing. And if you place the cuff over the clothing, then this could damage the results because the clothing adds an extra layer and it could be difficult to get an accurate blood pressure reading. Okay, so this looks like it's correct also, but we did put option A as our choice. So, let's eliminate this because there might be something better when we read the other choices. Option C says measuring immediately after the patient has eaten. So anytime you see words on an exam like immediately or strong words like always, this is usually a sign that this might be something to look out for. And since the question here is asking about an error, and this is saying immediately, that should raise some attention. And yes, taking blood pressure immediately after eating could change the results. It might make it abnormally higher. So option C is looking correct as well. But we do notice something. If you look at option D, it states all of the above. And since while looking at options A, B, and C, they all looked correct to us, that means that we should go with option D, which is all of the above. So this question is a good lesson to not be too hasty when you make your decisions on an exam, to read all the choices before selecting one, because you could end with something like this where it has all the above, and you might have quickly picked option A without reading through options B and C to realize that option D is all the above and that those choices are correct as well. Hence we're going with D, all of the above.